Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi, and today we are joined by Dr. Michael Puente, who's here as an ophthalmologist to talk with us more about what he sees in kids and adults with Down syndrome and their eye care and issues that can come up. So, Dr. Puente, thank you so much for joining us on the podcast.
Thanks so much for having me. Happy to be here.
Well, great. Well, for our audience, tell us a little bit about who you are and what you do and really what draws you to this population, if anything. What is it that makes you enjoy working with people with Down syndrome?
Sure. Well, I'm an ophthalmologist. Specifically, I'm a pediatric ophthalmologist. So I work primarily at Children's Hospital Colorado in Denver. But I also run a clinic for adults with intellectual and developmental disability, where I see many, many adults with Down syndrome at the University of Colorado's Eye Center. And it's always been something that I've found really rewarding and professionally very satisfying, taking care of kids and adults with Down syndrome, because there are so many things that can affect their eyes and their vision. But importantly, there are so many things we can do to make it better. And so I'm always really excited to take care of my kids and adults with Down syndrome and getting to know their families and finding ways to help them out.
I love that. I love that. So no personal family connection of your own, just a heart for this population.
I do have a cousin with Down syndrome on
Oh,
both sides of my
interesting.
family. I have a cousin on my dad's side and a cousin on my mom's side, uh, and I love them both to death.
I
But
love that.
uh, it's just something that I really enjoy working with this population in my
Yeah.
practice here in Colorado.
As our listeners have heard many times before, it does seem like those of us who have had an impact with somebody in our family with Down syndrome. My brother has Down syndrome, and so for us, this does really seem to fit a need for us career-wise, but also allows us to give back to people that we have met in our lives. So that's great to hear. Well, why don't we go ahead and get started? Tell us a little bit more. What are some of the more common things that you'll see in kids, like younger kids? We'll get to teens in a second, but younger kids with Down syndrome, eye issues that you see, and maybe just some brief ideas of what families should do in terms of getting those things evaluated, managed, things like that.
Eye eye problems are very common in kids with Down syndrome, really across the lifespan. But a lot of those vision problems start in very early childhood. We recommend that every child with Down syndrome should get an eye exam at some point in the first year of life because it's just so common that there are issues. Some of the most common things that we see in little kids with Down syndrome would be that they often end up needing glasses at a really early age, much
Mhm.
younger than their peers. If you need glasses, it generally means that your eye doesn't have quite the right size or shape to be able to focus light clearly. And the eyes of kids with Down syndrome grow differently from the eyes of kids with 46 chromosomes. And so that causes them to need glasses at a much earlier age, often with much stronger prescriptions than we see in their peers. I've prescribed glasses for kids with Down syndrome, before their first birthday. Usually it's
Hmm.
not quite that early that they need glasses, but oftentimes these kids end up being some of those really cute little kids you see walking around with glasses at an early age. Other things that we see commonly in kids with Down syndrome are like a blocked tear duct.
Mhm.
So the tear duct or the nasolacrimal duct is the connection between your eyelid and the inside of your nose, and that's where tears are supposed to drain out of the eyes. But with some of the differences in the facial structure and anatomy of people with Down syndrome, the tear duct in kids with Down syndrome often never opens on its own. And so these kids commonly have an eye or both eyes that are constantly tearing, constantly crusting. And that's something that we can fix as pediatric ophthalmologists with a very straightforward, quick procedure under general anesthesia, kind of analogous to putting in ear tubes. Another thing that's very commonly needed for kids with Down syndrome, we can pop open the tear ducts and put a little tube in there.
Mhm.
Some more serious things that we can find, or one more serious thing that we can find in kids with Down syndrome is congenital cataracts. About 2% of kids with Down syndrome are born with a cataract, about one out of every 50 babies with Down syndrome. And we generally think of cataracts as something that happens as people get older, but pediatric ophthalmologists take care of kids with cataracts, and Down syndrome is one of the most common causes that we find cataract in a child. So, what a cataract means is that a layer on the inside of the eye called the lens that's supposed to be crystal clear like a window, it's not crystal clear. It's kind of cloudy.
Hmm.
And if a baby is born with a cataract, then it blocks light from getting into their eye and it prevents vision from developing in that eye. So it's something that we want to remove as quickly as we can, generally before they're a month or two old. And that's something that your pediatrician should be able to check for by a test called the red reflex test, where they look to make sure that they can shine a light through the baby's eye and see a reflection from the back of the eye that tells us that the lens is clear. If there's a problem with that test in a newborn with Down syndrome, then they really need to see a pediatric ophthalmologist quickly so that they can get surgery so that they're not left blind from that cataract.
Wow, that's great. I appreciate you bringing that all that to our attention. I guess just some follow-up questions I have for you. When you were talking about the glasses that people with Down syndrome may often need earlier in life, is this because they can't see near, they can't see far? Could it be any number of those things? What are some reasons they may need glasses?
Any number of those things. I take care of lots of kids with Down syndrome who are extremely nearsighted. I take care of lots of kids with Down syndrome who are extremely farsighted. I take care of lots of kids with Down syndrome who have really high astigmatism, meaning that their eye is shaped a little bit more like an egg or a football rather than a perfect sphere. And that
Mhm.
makes it harder to see without glasses. They don't, tend to be one of those three things in particular. It's just that they have really high rates of needing glasses, but
Okay.
it can be nearsightedness, farsightedness, stigmatism.
I've seen some kids too often who'll get glasses prescribed because of eye wandering, what we might
Mhm.
call strabismus or something like that. Maybe you could address that a little bit here for us. Is that something you'll see early in life too for kids?
Yep, that's another thing that's very common in kids with Down syndrome. About 50% of kids with Down syndrome develop strabismus or eye misalignment. So, in kids with Down syndrome who have strabismus, about 70% of the time, it's that one of the eyes is turned in towards the nose, what we call an esotropia. And then about 30% of the time, it's an eye that drifts out towards the ear, what we call an exotropia. They're generally not born with that. It's something that tends to start in early childhood. Sometimes it's correctable with glasses, but in most kids with strabismus who have Down syndrome, it's something that needs surgery. And it is something that we can fix. I've unfortunately taken care of a lot of adults with Down syndrome whose families didn't realize it was something that was correctable. And there's a pretty straightforward surgery that a pediatric ophthalmologist can do to straighten their eyes.
And in terms of wearing glasses for any of the number of these conditions, a lot of the times the kids they have a flatter nasal bridge, and so the glasses are often not built to stay on their face, and so they'll start to fall off or not be well tolerated by the kids. Do the frames matter? Do you feel like are there certain frames that you have found or styles of frames that you have found that work better for kids with Down syndrome?
Yeah, there are some kids with Down syndrome whose noses make it harder for the glasses to stay in position. There are a lot of different brands. Anywhere that sells glasses to children will have some different frames that you can try out and see what seems to fit your child's face the best.
Okay.
Many of these kids end up with glasses that have a strap in the back
Hmm.
that just provides an extra layer of security and support to help to keep the glasses on.
Awesome. And thinking about when you were talking about the tear duct massage, I'm sorry, the tear duct blockage, one of the things that I've often wondered is people will sometimes say like massaging the side of the nose to help with the drainage. Do you find that to be helpful long term for the kids at all? No.
No, that doesn't help. The
Yeah.
tear duct is surrounded by bone.
Hmm.
And so if you're massaging around there, you're just like massaging the outside of that bone. It's not going to have any impact on popping open a blockage on the inside, on the other side of that bone.
Okay.
I find that's something that a lot of people will do, and some doctors will recommend, in a sense, to give the families some empowerment
Yeah.
to feel like they're doing something to help, but it really doesn't make much of a difference. A blocked tear duct in someone with Down syndrome generally needs surgery to fix.
Okay, okay. And sometimes they will open up on their own, right? Or
It
over
can open
time.
up on its
Okay.
own. In the
Uh-huh.
general population, about 90% of kids with a blocked tear duct will have it open up on its own. In kids with Down syndrome, though, unfortunately, it usually doesn't open up on its own.
Okay. Okay. And then what are, as we move on to, as they get older, as they get into the double digit ages, the teenagers, what are some things that you maybe start to see in that age, or maybe can continue to see even from their pediatric site, when they were younger? What are some things that still continue in their eyes?
The biggest thing that becomes a concern when people with Down syndrome hit their teens is a disease called keratoconus that can be found in up to about a third of people with Down syndrome. It's a disease of the front layer of the eye called the cornea, which is basically like the windshield of the eye. It's a crystal clear barrier right at the front of the eye, and it's supposed to be pretty rounded in shape. But in keratoconus, the eye starts to kind of change its shape, and the cornea changes from being round to being pointed, having a cone shape or more of a triangular shape. And as the eye grows into that more pointed cone shape, as the person gets older, as they progress through their teens, it becomes pointier and pointier, more coned as they get older. And as this process is going on, the vision gets worse and worse. And it can progress to blindness, where the cornea gets so distorted that uh, it ruptures on the inside and can scar. And their cornea can become completely white and opaque instead of being crystal clear like the windshield it's supposed to be. That's a process that tends to start around puberty, and it's a very common disease in people with Down syndrome. So when I see a teenager or a young adult with Down syndrome in my clinic, I automatically order testing to look for keratoconus. And if you don't specifically look for it, it's easy to miss in its early stages. So, for anyone who is taking care of a teenager with Down syndrome, when they're getting their eyes examined, you need to make sure that they're specifically looking for keratoconus because some people who maybe don't have as much experience or expertise taking care of young people with Down syndrome, they might not know that they specifically need to be looking for that.
And
And
what are
there are
some,
certain.
I was
Mhm.
going to say, what are some things that they may look for? The family may want to say to the doctor, I heard on a podcast that when you're looking for this, you should look in this way.
So the best test to diagnose keratoconus is something called a corneal topography, which is where the patient puts their head up to a machine. It's like a big camera, and it builds essentially a 3D map of the cornea. And it measures the shape of the cornea, how thick it is, how steep it is, and how flat it is in different areas. And that's the gold standard test to look for keratoconus.
Okay.
Not every office that does eye exams has that machine. In
Mhm.
particular, if you're taking them to kind of a neighborhood eye clinic and not a really specialized clinic, they may not offer that test.
Mhm.
So it's something that families should specifically ask for if they have a teenager with Down syndrome. And if your eye doctor's office doesn't offer that test, it might be worthwhile to make a visit to a place that does at least once in the teenage years to screen for that disease.
Is it something that they'll have symptoms? Like, can the person with Down syndrome, let's say if they're verbal, able to share what they're feeling, will they say it feels funny when they close their eyelid, or is it just really asymptomatic?
It's often asymptomatic, unfortunately, in the early stages.
Uh-huh.
Some risk factors would be people who have really bad allergies around their eyes, people who rub their eyes a lot, or people who have a family history of keratoconus. Also, people who have really high astigmatism in their glasses. Those are all risk factors for developing keratoconus.
Great.
And
So,
I'll add that the reason it's so important to look for keratoconus and to diagnose it is that there is a treatment to stop it from getting worse. Uh, Again, keratoconus is a disease where the cornea, the front layer of the eye, is changing its shape, growing into an abnormal shape that's causing your vision to get worse and worse as the cornea's shape gets worse. But there's a procedure we can do called corneal collagen cross-linking that makes the cornea more rigid. It basically locks it into its current shape. So if we diagnose that someone has keratoconus, we can perform this procedure and keep it from getting worse to lock in and protect their current level of vision.
That's so great. And it's so important, again, highlighting the importance of knowledge, which is why we do this podcast, so that our listeners can all know the importance of catching things early when they can still be managed. So that's really important. And thanks for bringing that to our attention. Are there things that you might see in adulthood in people with Down syndrome, things that may not have presented until that time that you might start to see for an adult?
One of the biggest things that I see in my adult patients with Down syndrome is cataracts
Mm.
that develop at an early age. So we mentioned earlier that about 2% of babies with Down syndrome are born with cataracts. For the other 98% of them, they tend to develop cataracts at a much earlier age than the population at large, even if it wasn't something that they had at birth. So that's something that also tends to start around puberty. When I'm doing eye exams on my preteen and teenage patients with Down syndrome, I tend to start noticing little areas of the lens on the inside of the eye that are cloudy. And the lens inside your eye is supposed to be crystal clear like a window, but in people with Down syndrome, they tend to get little blue speckles that form generally in your preteen or teenage years. And then every year they get a little bit bigger, a little bit more plentiful. And eventually it gets to the point where the lens has become so cloudy that they can't really see through it anymore. And the treatment when it gets to be that bad is a surgery to remove the cataract and put a new clear lens inside.
Mm.
For my young adult patients with Down syndrome, um, I find I'm often recommending or talking about cataract surgery around the same time that their parents are
Ah,
having the conversation about cataract surgery with their own ophthalmologist.
okay.
It's something that happens decades earlier in people with Down syndrome. Um, I think it's also important to keep in mind that there is a risk of cognitive decline and dementia in people with Down syndrome as they progress through adulthood, and vision might sometimes be a factor in that. If you notice that your loved one with Down syndrome is having some cognitive decline, if they haven't had an eye exam recently, that's probably a great time to go get an eye exam. Because if someone's vision is getting worse, potentially from cataracts or some problems that can happen in other parts of the eye in adulthood, that can limit someone's ability to interact with the world as richly as they could before. And there have been plenty of studies, in particular in the general population, not just in the population with Down syndrome, but that have found that vision loss or worsening of vision in adulthood increases the risk of cognitive decline, and that if we treat those vision problems, cognitive performance can improve. So I've had several patients I've seen in my clinic for adults with intellectual and developmental disability who hadn't had an eye exam in years, and then they had behavioral changes, some cognitive changes, and it was recommended that they get an eye exam. And then we find that they actually had major vision problems that weren't being addressed. And I think that that's probably a factor in some of the cognitive and behavioral issues that we find in some of our adult patients with Down syndrome.
Yeah, it's so important. And I think that's something our listeners have heard many times before in terms of the importance of looking for medical causes to behavioral changes. And that I think is universal, whether we're talking about in pediatrics or in adult care, that if something changes, make sure that you've sought out a medical evaluation for many things, including vision and hearing and celiac and thyroid and all the other things that we've talked about on this podcast. So thank you for bringing that to our attention again, Dr. Puente. So, I guess as we get close to the end of this podcast, I wanted to ask you, is there anything that we didn't cover or any general statements you want to make sure you leave with our audience about eye care for their loved one with Down syndrome?
Just reiterating the importance of getting their vision checked regularly.
Yeah.
We recommend that every child with Down syndrome should have their eyes checked at least once a year, just because the risk of vision problems is so great. And there's often so much that we can do to improve their vision. So we want to catch those things early while their eyes are developing, while their vision is developing. Once they get to adulthood, things tend to stabilize. And so if their eyes have generally been healthy in childhood, they maybe don't need to keep getting an annual eye exam in adulthood, but should probably be checking in with someone at least every few years.
Uh-huh.
If they do have any sort of vision problems, they probably should continue to be getting annual eye exams throughout adulthood.
Yeah.
I think it's also important uh, to distinguish between different people involved in eye care, because some people may have different levels of expertise and experience taking care of people with Down syndrome. So there are two main types of eye doctors. There are ophthalmologists like myself. We go to medical school and then complete at least 4 years of additional training in the medical and surgical management of diseases of the eye. And then there are optometrists who are eye doctors that go to optometry school instead of medical school. They don't receive surgical training. So they're great for providing primary eye care. They're great for managing glasses, contacts, and doing routine eye exams. But if your loved one has any medical problems of the eye, they probably should be seeing an ophthalmologist and not an optometrist.
Mhm.
And then within ophthalmology, there are lots of different subspecialties. I'm specifically a pediatric ophthalmologist. Pediatric ophthalmologists tend to have a lot of experience taking care of people with Down syndrome because it's just so common that they have vision problems in early childhood. So, any pediatric ophthalmologist has probably taken care of hundreds or thousands of people with Down syndrome and knows what to look for and how to look for it. Within the field of adult ophthalmologists, it's totally reasonable to ask your loved one's ophthalmologist or optometrist how experienced they are in taking care of people with Down syndrome and making sure that that they're looking for some of the things that we mentioned, in particular keratoconus for those teenagers and young adults. And if they don't feel that they're able to provide a really thorough eye exam, I think it's totally reasonable to ask if there's anyone else they recommend to check in with from time to time.
That's really great. And I love that. It's so helpful to know the difference between all the different people within the field. So thank you for sharing that with our audience. Dr. Puente, I really feel like this was a fantastic podcast, really highlighting a lot of important things throughout the different age ranges and somebody with Down syndrome when it comes to their vision care. So thank you so much for joining us on the podcast today.
Thanks so much for having me.
And to our listeners, thank you also for always being such fantastic listeners. You're always reaching out to me with different ideas of topics of podcasts that you think we should be covering on this podcast. So please don't hesitate to reach out to me at Down Syndrome Center at chp.edu if there are any topics you'd like us to cover. And if you'd like to join us in the work that we do here at the center, including supporting this podcast, you can go to givetochildrens.org/Down Syndrome Center. But until next time, bye-bye.